So welcome everybody to LeagueMed's 5x5 podcast. I'm thrilled to be joined today by one of our co-founders and early investor in LeagueMed, Paul Cella, who is a managing principal of KeyArx, and he is a significant thought leader in the space of investment planning, insurances, and financial service support for the healthcare community. LeagueMed, just a little bit about LeagueMed on our 5x5 podcast. LeagueMed is a digital investment platform geared toward the healthcare community to give professionals in that community access to a select group of private investments that they are frequently do not have access to. In addition, we have a number of other ancillary financial services, and we're here to talk about one of those today with a significant thought leader that we have on our team, Paul Cella. So Paul, with that, we'd love to hear a little bit about what's going on in long-term care insurance. As people get older, they worry about it a lot, but I'm not sure they always make the right decisions. And we'd love to learn a little bit from you about what's going on in this area and how people should be thinking about long-term care insurance as part of their long-term financial planning.
Well, Kate, a pleasure to be invited on the 5x5 today. And I've been in the insurance and financial planning world for 30 years. And long-term care planning has always been an important issue, especially when you're planning for retirement. But now more than ever, I'm glad you had me on because I wanted to express what's going on in the long-term care world and what's changed. And the changes that are occurring, to me, make this a pressing issue. I normally would address this issue when someone raises their hand and say, Paul, can you help me with that long-term care stuff? And then I would help them through it and how to go about it and how to plan for you and your family. But now the changes are each state, there's 22 states right now that are incurring a payroll tax. So if you are an individual and you're in your working years, you're going to incur this payroll tax. Now, again, I said 22 states. It's going to be all the states shortly, but right now, Washington State has already gone through legislation and they've implemented their payroll tax. And then there's states like New Jersey, New York, California, Oregon, Minnesota, and a host of others. We can go through the other ones that are currently in legislation. So I don't know the exact numbers, but those numbers are going to range from 0.5% to 1%, maybe more. So what does that mean with our high income earner people? And it could be a couple $1,000s a year of additional tax, but the bigger issue is if you're a business owner, what about your whole payroll? If you have a 10 million, 20, $30 million payroll, well, guess what? That 0.5% of that 1% is going to affect your bottom line. So
it is affecting. So as a business owner, I have to pay my own payroll tax, but I also have to pay for all my employees. So it's a huge cost for me. And tell me, what does that have to do with long-term care insurance? Tell me how that connects.
Okay, so long-term care insurance, just so we know, is if you need assisted facility, care in the home, nursing home, that's long-term care. And I'm sorry I didn't get to that earlier, but how does it affect the employees and the employer? Yes, you're going to have this tax that's going to be imposed, and on $1 million, that's it could be $5,000, $10,000 per $1 million of payroll. So it's significant. So where did you want me to go with that, Kate?
So what does that have to do with long-term care? So it's money that's being taken out of my paycheck, but how does that connect me with long-term care and how I can better think of that? Because I think one of the big numbers I saw in your materials is, an event can cost a nursing home can cost $180,000 a year. That's out of post-tax income. That's a lot of money, right? So tell me how the payroll tax and long-term care insurance.
They go together, right? So what's happening is it's like Social Security. States are going bankrupt with this issue. The statistics, because people are living longer, more people reaching age 100 now, we see that whole thing. The need for long-term care, the numbers are skyrocketing. So I'm hearing numbers north of 40% of healthy people today at some point in time are going to need long-term care. So what the states are doing, the connection with long-term care is they're saying we're not going to be able to afford paying for people. We're not going to be able to afford Medicaid, and we're not going to be able to afford paying for care for people. So we're going to impose this payroll tax that we're going to tax people, and we're going to create a fund each state, where right now most states are agreeing to pay you 36,500 total lifetime pool of benefit. Kate, that might be a couple months of care.
Well, so
So
a nursing home is like $180,000 a year, or an event might wipe that out right away, right?
exactly. So this pool that the state is, and again, we don't have every legislation could be modified and tweaked, but I'm giving you what the word is. So this isn't exact science, but about a 36,500 pool is a minimal amount. And the issue here is once the state approves the payroll tax, you're locked into that payroll tax. If you do something and you get a policy and you address long-term care prior to your legislation in your state going into effect, you may be able to get grandfathered out like Washington State did. Washington State said to their population, hey, if you have a policy before this date, you don't have to pay that payroll tax. So
Okay,
what
so
what
let me just kind of repeat that back to make sure I understand it. Right now, there's a payroll tax going in that would be what percent of my
0.5 to 1.2%.
0.5% of my payroll? And I will have to pay that. It's going to go into a fund which will not cover my long-term care costs, but that would go into the fund. If before that payroll tax goes in, I purchase long-term care insurance, I don't need to pay that payroll tax. Is that right?
It's yes, it's right, but I have to put a caveat on that. In legislation, I can't say emphatically you're going to get grandfathered out. That's the way the trends are, Kate. So if you have a plan in place, you should be grandfathered out. You probably will be grandfathered out of that payroll tax. But the legislation until that legislation is drafted and signed off on, I can't say emphatically you'll be grandfathered out. Okay, so
Okay,
that's
so let me say, I would love to do something about that. What should I do? How much is it going to cost me? And why is that a better financial decision for me than just waiting to be hit with a payroll tax?
great question. So the state plan, not only is it 36,500 is the amount that they're talking about. The other thing is they're talking about activities of daily living to qualify for that benefit. So activities of daily living cater things like eating, bathing, dressing, toileting, transferring, and grooming. Those are the basic
Yep.
activities. The state plans are saying if you can't perform three of those, they're called ADLs, activities of daily living. If you can't perform three of those six ADLs, then you would qualify for that 36.5 pool. An individual plan is two of six ADLs. So the state, the bar is higher to
Yep.
qualify. The amount of benefit is a couple months. So what I tell business owners is you should consider exploring an individual plan, a group plan, guaranteed issue for your employees, and get the minimum benefit, 36.5 or 50. I show people $50,000 policies for all the employees. And that $50,000 policy has better provisions like the two of six ADLs. And the benefit is actually cheaper than the 0.5%. So if you were, let's say you had $1 million payroll and that was going to cost $5,000, that individual equivalent might be $1,500 a year for that $50,000 pool. So
Yep.
the cost is lower. And then what I would say, Kate, the big issue is for the executive or for any employee, it goes for anyone. If you have the minimum amount as an employer, let's make it smarter for the employees. Let's make it better cost efficient as the business owner. But then each employee can have that minimum benefit on an individual basis and then buy up and do what's right for them on a family basis, on their individual family basis. And I tell people, tie it into your retirement plan, which I'll get into. And, if you want to expand on that a little bit, tie it into your retirement plan. So Kate, what you need for you and your husband is going to be different than what I need for mine and my wife, so you can design a plan that's set for you. But as a business owner, you can set up a plan that's a good plan for all the employees that gets them out of the, potentially out of the state plans, and then allow them to do something significant for themselves, with the buyout.
All right, so let's talk about how if I'm planning retirement, obviously my long-term care, and just kind of as a personal story, my father and mother, I took care of them both for about 7 years before they died, and they had excellent long-term care insurance, which made my life so much easier as a caregiver to be able to depend on that long-term care that would fully cover what their needs were. So from a personal perspective, I can't really emphasize enough how much of a gift that was to me, that my father gave me for caring for them, that he and my mom were well covered. So kind of personally, not only for yourself does it make sense, but for caring for you, it makes so much sense to have this planned out. So tell me how people should be thinking about their retirement and when they get long-term care insurance. And it seems like now there's an urgency with this payroll that's coming. So there's an increasing urgency to get it, to be able to provide for yourself and perhaps potentially a more comprehensive way than the state would do with the payroll tax. Is that right?
Yep. So let me start with the right policy, Kate. Today, there are two
Yep.
types. There's reimbursement and there's indemnity. And reimbursement is when you need care in the home, assisted or nursing home, you have to prove expenses, pay for them, and then you get reimbursed. It's a little clunky. I had it on my dad. It was a pain in the tail. We did, and it was just a big, long process. And I really didn't like it, and I don't recommend it. Then there's something called indemnity, which indemnity, once you qualify for those 2 of 6 ADLs, it pays you in cash. So you could pay whatever you want, and you could pay your nursing care, and then you can go pay your car payment with it. You could do whatever you
Right.
want. So indemnity is a cleaner way to do it. Cost wise, it's a little bit more money, but in my opinion, it's not even close as far as the clunkiness, getting rid of the clunkiness of a reimbursement. In retirement, what I suggest is, the conversation to me in the past before this payroll tax used to be, do you need long-term care? Long-term care planning is not buying a policy, I used to say to people. Well,
Right.
if you can self-insure, do you know you can self-insure? You should go through the drill. But now the payroll tax has made it, well, why pay for that payroll tax when you could just pay the minimum, like I said? But
Right.
what I would suggest is build it into your retirement plan, Kate. Most advisors that I've seen do what I call one-dimensional planning. And they say, build this mountain of money and you need, you have X amount of millions of dollars and you need 20,000 a month or whatever whatever your number is. You need that number in retirement inflated for inflation. And if nothing happens, well, you're okay, or you need to save more, or you need to cut your number down. That's one-dimensional planning. What I say, take your plan that most advisors do, and then go to plan two is add a claim. Add a claim at 80, 82, 85, and take the calculator, build in a claim, what you need, what your monthly number is, add a claim on top of it, and see how that affects your portfolio. I see a lot of portfolios with a claim run out of money. So that's the second phase. Build I call it phase two is event planning. And then phase three is if you introduce a long-term care pool of money, then you could say you have your assets in plan one, and then plan three would be when you add that claim on, the long-term care plan or the long-term care insurance soaks up that claim, and then you're left with the assets that you had without a claim. So
Right.
that's no claim, no event, and then with insurance the event. And then that's
Right.
three-dimensional planning. That's comprehensive, and that to me is peace of mind planning. That's complete.
So I just want to encourage everybody. I did it a little bit before Paul and I got on the phone, as I went to his handy tool where you can pick your state, you can put your amount of your assets in, and it calculates for you all kinds of things about what you can expect and not expect. And while some of us hate to look at what's left or not left because it makes us anxious and nervous, this is a way to relieve your anxiety because it gives you the information there. It gives you the information you really need to make a decision about what to do about it. So I really suggest everybody go take a look at it because it kind of helps you think through what exactly it looks like. It self-calculates this very cool spreadsheet. So go take a look.
And one last thing, Kate, what I do is for any LeagueMed listeners, if you want, we have a form that you could fill out, and we take some your basic asset amounts. We don't care what property you have in your assets, but we could put your assets in qualified, non-qualified, and we could build you out a calculator with no event with insurance and we do a simple plan for people and show you, hey, how's your assets going to look? And our team will do that at no charge to anybody that wants to.
Oh, that's great. Well, Paul, is something else I should be asking you that listeners should know about how they plan for retirement with long-term care insurance?
Well, the last thing I'll end on is, I feel like the urgency. Well, the payroll tax wasn't enough, Paul, so you gotta kick me while I'm down. You need more, right? Well,
Right.
one thing that's changed that's changing with all these advances in medicine and people living longer is family history. So the last thing I want to mention to people, and this is
Yeah.
why I say, if you have an insurance advisor, go to them, look into this because it really is important, and I can't tell you, in my 30 years, it's never been this timely. But now they're taking the insurance carriers that do long-term care are taking in consideration your parents' history. So
Right.
my parents both passed, but if I were getting it today, they would ask me the question now, did your mom or dad have Alzheimer's, Parkinson's? Did they have any serious health issues? And even though they passed, they would take that in consideration. And if I wanted to get $1 million pool of long-term care, they may say, nah, based on that, we're only going to give you 250. Or, Paul, they were really banged up. We don't want you, and they can decline you. That's the trend, Kate. So to me, it's not only the payroll, it's this family history stuff that's coming into play now, and it's only getting worse with AI because they can dig into family history
All
more.
kinds of stuff. Yeah.
So, so my leaving message, my parting message was, if you have an insurance person, go to them and ask them to, get into it. It's not, if you do a little planning, it's there's ways around it. You can utilize some of your IRA money, offset some of your IRA money. There's ways to spread out the payments. There's ways to, there's all different ways to um, there's life insurance policies that you can utilize that have long-term care built into them. So you can use some of your current assets and kind of, I call it shuffling the chairs around the deck, then
Yep.
just moving things around to position you to get some of this in your portfolio and not cost you a lot. So
Right.
there are a lot of things you can do. So I would strongly recommend look into it.
And your point is it's urgent now because the payroll tax that's looming in many states, and also because the trend is to make it harder and harder to get long-term care insurance because of the family
Bingo,
history aspect. So,
bingo.
like, do it now. Payroll tax, they're going to charge you anyway and give you less than you can live on from a long-term care perspective. And the trends are it's getting harder and harder to get because they're going to dig into all kinds of information about you before they decide what they're going to give you if they give you anything. Is that
Kate. That's it in a nutshell. And as a byproduct of this, the number one issue I get from all people is, with retirement planning. Do I have enough? Am I going to run out of money? What am I going to leave my kids?
right?
So I'm also giving you a tool to kick you in the butt and get your retirement plan done at the same time. And then,
Right.
what's better than that? So, this way, you're going to come out. People, when they go through this drill, care. It's not an exciting topic, but it's one you should address. But at the end, if you build it in with your retirement plan, I see all my clients, you're going to get peace of mind. You're going to get clarity of your retirement and peace of mind. So
That's
that
great.
would be my parting message.
That's great. Well, thanks for joining the 5 by 5 podcast. As a reminder, 5 by 5 was named after the clarity and loudness of radio transmissions. We often talk to founders of the companies that we have listed on our investment platform. We also talk to alternative asset experts, and we also care about the healthcare community and their financial well-being. And so we also invite experts in different areas of financial support for the healthcare community on. And today we're thrilled to have Paul, Managing Director from KeyArx, join us today and explain about long-term care insurance and why there's an urgency now to think about how that fits into your retirement planning.
Awesome.
Thanks, everybody.
Thanks,
You can
Kate.
you can visit us at LeagueMed.com. Our platform is free to join, and we let you know about deals that are coming, provide you with podcasts like these, and kind of make you part of our community to keep us all healthy, both financially and physically. Thanks so much. Okay, so Paul, when we talk about how this affects your tax returns and if there are deductions available or not, if you're a business owner or an individual, talk to us a little bit about what deductions are available for long-term care insurance purchases.
It's great, Kate. I always say Uncle Sam's giving this away because it's such a problem, and they're giving it away. They're creating tax incentives for whether you're an individual, whether you're an LLC, professional corp, S corp, C corp, and there's different amounts. So I always say consult with your CPA on the deductibility portion of it, and you need the right policies, Kate. Not every policy is deductible, but I'll use myself as an individual this year. Well, when I finished my 2025 taxes, there's a chart based on age, and I was able to deduct $4,800 of the premium. My wife is a little bit younger. She was about 1,800 and change. I forget the amounts. But it's significant and it's an offset to the cost. So as a C Corp, you can provide it as a benefit. It's 100% deductible as a C Corp.
Wow.
And
Wow.
so depending upon how you're set up, there's either an individual S Corp, like I said, the different entity types, there are tax. Uncle Sam is trying to incentivize people to get this done and to get policies out there. So when you deal with your accountant or your CPA and you're filing your taxes, net, oftentimes it doesn't cost that much to get what you really need.
Right. Well, it seems like Uncle Sam knows that they won't be able to pay for what people need. So they're giving all kinds of incentives to make people take care of themselves in a way that's financially responsible and they can handle. So lots of deductions to make them do it. It's a great
Correct.
incentive, really great
Yep.
incentive.
Good.
All right. Thank you, Paul.